So is MDS really a cancer, and how does it relate to other cancers? It is considered to be a cancer. Beginning in about 2001, its diagnostic code changed to being a cancer, and therefore its data was captured in what we call the SEER registry data. We typically think of cancer as being this very bad prognostic type of disease, and patients quickly progress and have a short survival. MDS, myelodysplastic syndromes, has a group of disorders, so it's not just one type of disease. It's many different types of disease that we group together that have this clonal hematopoiesis, cytopenias, risk of progression to AML, and share in common some abnormal findings within the bone marrow, what we call dysplasia, which stands for basically abnormal growth. So the distinction between what most people consider to be cancer is that some of these patients with MDS actually may have a relatively good quality of life, not a lot of pain. They may have very mild symptoms, or honestly, no symptoms at all. And so when they hear the word cancer and what it carries with it, the emotional baggage and such, they think, accordingly, that doesn't really describe how I feel or what's going on in my body. But I think it's important to remember that MDS is a group of disorders that are interrelated, but it's not necessarily a single disease. And there are some patients with MDS who do more rapidly progress and have more symptoms.
Myelodysplastic syndromes are somewhat different from other cancers in the sense that from blood cancers, that many blood cancers usually have a lot of cells in the blood. So for example, acute myeloid leukemia, you'll have a lot of those premature white cells in the blood. In multiple myeloma, you have a lot of those plasma cells. In lymphomas, you have a lot of those immature lymphoblasts or lymphocytes. What happens in myelodysplastic syndrome is that a lot of those abnormal cells that are proliferating quickly are dying within the bone marrow before they get released into the blood. So you end up in a situation of what we call paradoxical hypercellularity in the bone marrow. So there are many cells within the bone marrow, but they are dying before they go to the blood. So you end up with pancytopenia, low blood counts, while there are many cells in the bone marrow. And it's another term that we use for this phenomena is ineffective hematopoiesis, because there's a lot of proliferation going on in the bone marrow, but those cells, because they are abnormally maturing and dysregulated, they die before they get released into the blood, leading to low blood counts.
When talking about progression of MDS, it's important to remember that most patients with MDS actually do not progress to AML. We tend to think that all patients with MDS get AML, but that's not true. And particularly for patients who have lower risk disease during their lifetime, they likely would not progress to AML. So when you look at the risk of progression to AML, the model that we use is called the IPSS-R, International Prognostic Scoring System, revised. And in that system, patients who have high-risk disease, for instance, or what we call very poor risk disease, 25% of patients would progress to AML on average at about 0.7 years. But if you look at good risk patients, it would take about 9.4 years for about 25% of the patients to progress to AML. So for patients who have, better risk disease during their lifetime, they likely would not progress to AML.